Thank you, Chairwoman Eshoo. Mr. Carter is recognized.
Move to strike the last word.
Gentleman is recognized for 5 minutes.
Thank you, Mr. Chairman. And may I remind my colleague, Ms. Eshoo, she just made the comment that Schedule I drugs are killers. Marijuana is a Schedule I drug, so thank you for pointing that out. I appreciate it. Also, I want to express my due respect to the physicians on this committee for their opinion on this legislation. And I do respect them, and I do understand how they feel about this. But as a pharmacist for many years, I also have strong feelings about this, primarily because of the inconsistency of the composite boards of medicine throughout the country. And I do believe that we need something to be more uniform. I've witnessed it in my state and in other states that I have practiced in that they are inconsistent in how they apply the continuing ed on this particular, on the use of opioids. So I want to thank Chairman Pallone and Leader Rogers for including this Medication Access and Training Expansion Act in today's markup. Representative Trahan and I appreciate the engagement with our colleagues on the committee and stakeholders, including provider groups and patient advocates, which resulted in improvements to the language before us today. And there were improvements to the language, and I appreciate that. We do have a problem. The CDC released new data last week showing a record number of overdose deaths, 107,000 lives lost in 2020 and 2021, and experts predict that the crisis will not stop in the next few years. In 2019, the national nonprofit Shatterproof conducted a provider study which found that only 1 in 4 of those providers had received training on addiction during medical education. Less than 1/3 of surveyed emergency room OBGYN or pediatric providers felt prepared to screen, diagnose, provide brief intervention for, or discuss and provide treatment for opioid use disorder. This MATE Act would establish a one-time substance use disorder education requirement tied to a provider's federal DEA registration, which is required to prescribe controlled substances. Most states have continuing education requirements in place, and the one-time training requirement would not create any additional burden for those providers. As more and more individuals present with substance use disorders in a variety of settings from primary care to the emergency room, all medical professionals need to be equipped to care for these patients in crisis. It is a matter of life and death, and I ask that my colleagues support the MATE Act for every American in need of treatment for substance use disorders. Again, I want to thank my physician friends on this committee and colleagues on this committee for their very valid points. I could not agree more about the problem with fentanyl and the fentanyl that's coming across our border. Yes, that is the problem. However, as a practicing pharmacist for many years, for over 30 years, I can tell you that at times I felt like a policeman, and that I was supposed to be making a decision on whether a physician's prescription was legitimate or not. And I don't think that's what I know that's not what we were trained for. That's why I think this is necessary. I am not questioning anybody's training, and I understand that doctors are some of the most well-trained professionals, the most well-trained professionals, in my opinion, out there, have an enormous amount of respect. But I do think this is necessary. I do think it's necessary because of the big problem that we have right now with addiction in our country. And because of my experience as a pharmacist and seeing prescriptions being written by physicians and disciplines that they have no reason to be writing these prescriptions at all, and they should at least have some minimum training as a result of that. And with that, Mr. Chairman, again, I encourage people to vote for this, and I yield back.